Say it clearly, say it right, between two voices.
Welcome to Between Two Voices, where language meets care. I'm Dr. Desiree Diaz, professor and assistant dean at Vanderbilt School of Nursing.
I am Ruben Diaz, founder of Titus Language and Educational Services. I'm a service-connected submarine veteran and a trained medical interpreter.
Well, welcome. Thank you for joining us. We have a short video clip we would like you to see so then we can discuss and talk about the nuances together. Stay tuned.
Okay, let's dive right into this explainer and examine a really dramatic scenario. We're talking about a situation where one tiny, seemingly harmless linguistic detail almost triggered a massive medical emergency. It absolutely blows my mind how complex and honestly fragile human communication truly is, especially when lives are literally on the line. How can a single word mean the difference between a cure and a massive overdose? To answer that, we're going to look at a high stakes but super relatable situation that perfectly illustrates this terrifying reality in healthcare. You know, when we go to the doctor or the pharmacy, we just assume that a printed label is the ultimate source of truth, right? We trust the text. But what happens when that text acts like a linguistic chameleon? Let's break down exactly how one innocent word can completely flip a safe dosage into a potential disaster. So, the prescription skit. Picture this. We're in a bustling clinic. A nurse, let's call her Desiree, is swamped. She wants to save some time, so instead of calling in an interpreter, she simply hands a prescription bottle directly to her patient, Ruben. Now, Ruben only speaks Spanish. The label on the bottle is, well, it's sparse but seemingly clear. It attempts to instruct him with 3 exact English words. Take once daily. Now, to an English speaker, this is entirely unambiguous, right? Take 1 dose, 1 time a day. But Desiree isn't explaining this verbally at all. She's relying entirely on those printed letters to do the heavy lifting for her. And here is the exact moment communication completely breaks down. Ruben looks at the label and he reads the letters O and CE. But, and this is the kicker, Ruben is reading this through the lens of the Spanish language. He misinterprets the English word for a single dose as the Spanish word once, which is pronounced once. And once means 11. This leads to an absolutely shocking and dangerous mix-up. Ruben walks away believing he must take 11 pills instead of 1. Just let the gravity of that sink in for a second. Because of 4 little letters printed on a sticker, a patient is now on the verge of taking 11 times the recommended dosage of his medication. A completely innocent attempt to read a label has suddenly escalated into a severe medical emergency. Which brings us to the false cognate trap. So the absolutely crucial point to understand here is that this was a reading mistake. It wasn't an auditory one. Ruben didn't mishear Desiree. I mean, if she had spoken the English word out loud, he might have been confused, sure, but he wouldn't have heard the Spanish word for 11. No, he was simply caught by the identical spelling of what linguists call a written false cognate. It's when words are spelled exactly the same across different languages but possess entirely distinct meanings. The letters are identical, but the actual definitions couldn't be farther apart. This quote perfectly captures the issue. Words spelled the exact same in English and Spanish can cause severe medical miscommunications. Relying on written text without linguistic context isn't just a minor oops moment, it's a systemic issue that actively threatens patient safety. When healthcare providers assume a written label is universally understood just because it's printed clearly, well, they're unknowingly walking their patients right into this false cognate trap. Now the professional interpreter steps in. Let's rewind that dramatization for a second. This time, an official, trained professional interpreter is in the room. By repeating the interaction properly, the interpreter executes 3 distinct steps to intercept that written false cognate. First, they read the label themselves. Second, they actively translate the meaning, not just the raw letters, to the patient. And third, they verify that Ruben actually understands the dosage. They guarantee he knows exactly what to do, which entirely removes the dangerous ambiguity of the written word ONCE. Securing medical communication. This brilliantly illustrates the exact moment where a potential tragedy is averted through proper professional intervention. It highlights the true value of trained medical interpreters. They do far more than just translate back and forth, right? They actively intercept these dangerous reading errors. They spot and correct those invisible written false cognate traps before they can cause harm. They are literally securing understanding and preventing severe, life-threatening mistakes from happening right under our noses. So, I'll leave you with this provocative thought to wrap up our explainer today. If a single four-letter word can hide the difference between 1 pill and 11 pills, what else is getting lost in translation every single day?
So I hope you enjoyed that clip. And that clip really starts to make you think about linguistic access, but also the nuances of interpretation and translations, which are two different things. So, Ruben, let's unpack that a little bit. So, being a non bilingual healthcare provider, I'm curious, what does it exactly mean being a false friend? Now, I looked it up. We can all look that up. And I'm not really sure how that relates in linguistic terms or English terms. So bring it to a high school level English class for me.
Okay, so for clarity, when they're talking about false friends in grammar, we call those cognates. You have regular cognates and you have what they call false cognates, what we call. So a false cognate is two words that look identical but do not have the same meaning. So or they're spelled identically. Like in this case, like once and once do not mean the same thing. A cognate is a word like a nation. In Spanish is nación. They look the same, they mean the same, they're spelled almost identically. That's a cognate. So cognates are words that are, using the terminology, they're friends. It means the same thing. So if I say it in English and I say it in Spanish, there's not going to be any confusion.
Like sofa and sofa.
Correct.
Okay.
So the issue that arises, especially in this setting, because one mistake can actually be grave, is words like that, like embarrassment, like I'm embarrassed. A lot of times people think, or I'm excited. In Spanish, the word is excitado, but they don't mean the same thing at all. Excitement in English versus in Spanish it means aroused. So it's a very different, I'm excited about a birthday party. You don't want to say, estoy excitado de cumpleaños. That's not, it doesn't jive. So it gives a different context, a different meaning to what you're actually trying to say, because they're false cognates, they're false friends. So that's what we want to stay away from. And that's why it's important that the person understands context, not just be bilingual.
Okay, thank you for that. Now, I value my bilingual colleagues, peers, and friends because I don't have that skill. However, I have noticed at the bedside, there is a difference between a bilingual provider and someone trained in medical interpretation or translation, even at the bedside. And can we talk just a little bit about the patient safety aspect of that? Why is it wrong, I guess, is the bigger question, to utilize the services of a colleague or a peer in the clinical environment?
Before we do that, may I just suggest that for clarity, you're using interpretation and translation synonymously, and they're not synonymous. Interpretation is the changing of verbal language from one language to another, where translation, it's written language. So there, even though a lot of people use them simultaneously, and I'll even throw this in there in Spanish, when we say traductor, you're actually talking about an interpreter. So that also can be a little confusing to people. But in English, translation is the written word from one language to another, where interpretation. So what we're actually talking about here is actually interpretation. Now, why is it important to know the difference, or to, what would be a good way to put it? What would be the proper way to do it? You have to think about what's at stake. So if we are talking about ordering food and I make a mistake, it's no big deal. But contextually, sometimes when somebody doesn't have the register or the understanding or the knowledge of what we're actually talking about, and that's where, and before we say professional medical interpreters, you also have certified medical interpreters, and that is a guarantee to you that person understands medical terminology, and also, like I mentioned in the video, that these are people that understand protocol. They understand HIPAA. They understand a lot of other things that are not just language based, that are based within the context of where the patient is, where the hospital. There's, we don't talk about what just happened with anyone and things of that nature. The patient can be assured that their privacy is maintained. So that's one of the things that separates a professional interpreter from a colleague who might not be in healthcare, because just because you're in the hospital doesn't mean you're a provider, that you understand those things that we're talking about. You might grab janitorial staff, or you might grab a secretary or somebody like that who might not necessarily know those things. So that's why I think it's really important to separate the fact that somebody can be bilingual, but that doesn't necessarily mean that they are an interpreter, let alone a trained interpreter, versus somebody who actually has training and understands what to do and when to do it within the context of that scenario.
So for our listening and audio guests listening in, you have served as my medical interpreter in numerous places, as a matter of fact.
Many times.
Many times. And what I find is, all transparency, I know enough Spanish. We're utilizing Spanish as an example here because that is his native tongue. But I know enough Spanish to be dangerous. And what I say about dangerous is, when I'm providing care to my patient at the bedside and I have a trained medical interpreter, it's very different than an ad hoc interpreter that is utilized at one of the places that I serve as a nurse practitioner, as a provider. And there are often times where I'm finding the words that the bilingual medical assistant or secretary is also finding the words. And we're not going to get into the laws of the land currently regarding what and who is required to have interpretation services at appointments. Can you explain the differences, and is it ever beneficial to have that ad hoc interpreter or that family member? What is the difference? Because there is a cost associated with trained medical providers, and I say providers because oftentimes trained medical interpreters are in on those education sessions with patients, so they have a cadre of vocabulary that someone who's bilingual might not have. Can you just unpack that a little bit for us?
So I'll use myself as an example. When what you just mentioned, I've been doing this profession for going on probably 3 decades. So I have been in so many different procedures and have heard that procedure explained, because I'm not the one explaining the procedure. It's actually the provider who's explaining the procedure. So I get to hear that procedure explained over and over and over again. Does that mean that the provider should say, oh, you know what it is, because we've worked together for a long time, like we have. You know what it is, explain it to the provider. As a professional medical interpreter, I don't say, oh, okay, I'll take that upon myself, and I do that. The people that work with me know that because of my training, I don't allow that to happen. I am not the provider. I don't want to be the provider. And I don't want to give that patient the incorrect information. The patient should come directly from the provider to the patient. Like in the video, I mentioned the different things that an interpreter can be. I'm the conduit. I am the way in which information travels from one person to the next. I'm not the one that creates the information or creates it or gives the advice or anything like that. I'm just like the bridge that connects the two. That's it. So I want to make sure that that provider is explaining it. Now, I might know the procedure. I might know how to do the procedure, not physically, but how the procedure goes about. That's a benefit to me because I then have the proper tools to explain it in the target language to the patient. And I think that's really important. And that's the difference. If you bring somebody who is not familiar with the procedure, who's not familiar with the terminology, that's where people start to make up words to try to explain something. and oftentimes it doesn't come across the right way.
So I want to go back. A few moments ago, you talked about two words that tie in here now: the register of both the target audience or the patient in this situation, as well as the register of the interpreter. And I think that is what the nuances and the difference between an ad hoc interpreter or a bilingual colleague. I find that you know all the linguistic nuances and ways to bring up the register or lower the register so that my patients understand exactly what I'm trying to say. And I often find that family members or ad hoc interpreters might not have that level of expertise, and I'm not as comfortable. Am I correct in that assumption?
Yes. One of the things that we do as when we use the title, we're professional medical interpreters. Our education, our training doesn't stop. There's always new things. There's new medications coming out. There is procedures that change. There's new procedures that come out. So our training doesn't stop. For one, at least for me, it doesn't. I continue to read publications and look up things both in English and in Spanish, so I make sure that I understand. I confer with colleagues. I confer with other providers and things of that nature. So that's important. That's the thing that you don't have with somebody. I could go. I'm thinking of my mom in the hospital, not understanding. She thinks she knows, but she doesn't know. So it's those kind of things that are important because you might not be exposed to that information, that terminology all the time. And when we're talking about register, we're not just talking about I'm more educated than you. It's not about education. It's about understanding and having knowledge of what it is that you're interpreting and what information you are providing for that patient and making sure that it's accurate.
So, as a monolingual person that truly aspires to be bilingual at some point, is there risk in me practicing my Spanish with a patient?
Absolutely not. I think that one of the things that I tell the providers that I work with, it's important to understand that I'm not building up a relationship with that patient. You are. So you practicing all brings you further along that bridge. So you can make a connection with your patients because maybe next time you're going to have another interpreter. You might not necessarily have the same person. So that relationship building, I think it's crucial to good care. So I tell people, try it. It's good. It works. But understand when you're going to go explain a procedure, that's when I come in. You know, when you're talking about, hey, how you doing? You're introducing yourself. You're creating that. That's important. But then know what your limitations are when we can come in and sort of pick up the slack.
Well, thank you very much. Stay tuned for future episodes about linguistic access, culpability and liability of using bilingual faculty staff, peers and colleagues versus trained medical interpreters, what those nuances are, and some simulation practices. So stay tuned for Between Two Voices, where language meets care.
Between Two Voices.
All right. So we've seen a little video. You've heard some dialogue with my guest. Now we're going to put Ruben on the hot seat with a little Mythbusters. Are you ready for that?
I'm down.
Okay. So, first myth. It is appropriate to utilize Google Translate or any other translation services via AI, your telephone, earbuds that now have translation in the healthcare setting.
I will give you the quick answer. And the quick answer is, of course, professionally for job security, the answer is no. However, there's a reason why I say no. The reason I say no is because AI and those other tools that you spoke about do not pick up context and do not pick up nuance. So that's why when people in my field kind of freak out because of AI and Google Translate is going to run us out of jobs. I don't feel that way. I think that the human element will always be a part of what we do. And as of yet, it can't be replicated. So I'm 100% secure that within my lifetime, I'm not going to be obsolete.
Okay, thank you for that. I feel like we need to have a big gong. Okay, myth debunked. Okay, now what about using kids for translation? So oftentimes you see a multi-generational household where maybe mom and dad are at work and they're asking their teenage child to take grandma, grandpa to the clinic, to a doctor's appointment, to help facilitate that appointment and interpret.
Well, again, the simple answer is I absolutely am against that. And the reason why, and I'll give you the very shortened version, is years ago when we were talking about legalizing interpretation at the state level, I met a doctor who actually spoke about being that child who found out for the first time that his grandmother had cancer. And she told him that he couldn't tell the entire family. So that affected him. And he was now he was in his 40s. And he spoke about the trauma that he felt having gone through that experience. So I'm absolutely against that. You should, you shouldn't use family members. But specifically children, they don't have, number one, that they most of the time don't have the language skills to actually do that accurately. And two, you really don't know the kind of trauma that you might be causing a child because of the information that they're being given that they probably shouldn't.
And it's really the liability, not just for the provider, but misinformation. I can't
Absolutely.
imagine for that young child interpreting for their grandparent. I've heard that before. So let's close this learning loop here on our voices segment today. We have seen a video that sort of walked us through, I like to call them trigger videos, something for us to discuss and talk about. Some of my takeaways from that was really the trained medical interpreter is more than a verbal dictionary. It is an extension of me at the bedside where I have to have that relationship with you or a trained medical interpreter and understand that you are acting on my behalf in the patient's best interest for patient safety. Then I also brought that in, and some of the key things you talked about are those double words. And I have been in situations where I call them workarounds, where I didn't know the word of this, so I described everything around what that one word was that I was looking for, which does, sort of increase costs because it's more time to do a workaround than to have a trained medical interpreter with you. But I also want to make sure we close this segment with really understanding it is between two voices. We are sharing our voices together to have one unified voice to ensure linguistic access and patient safety for people who speak another language as their preferred or first language. And I think that's the key takeaway. So thank you for joining us. I hope to have you back on future segments, and stay tuned for the next episode of Between Two Voices.
Say it clearly, say it right, between two voices.